So retinitis pigmentosa, it's an eye disease and it is considered as a genetic condition, can affect 1 over 4,000 people worldwide. It is caused by a loss of the light sensing cells. Light sensing cells, which are called photoreceptors, because normally from the light that we got from the environment, it hits the retina, which is lying in the back of the eye, and leads to have a signal which these photoreceptors are able to transform this signal to electrical impulses, and through a series of connection it can go back to the brain and can present as a side. So in retinitis pigmentosa patients, they have a degeneration regarding the light sensing cells, which lead them to have total blindness as well. And the light sensing cells can occur or can come in two kinds, such as rod and cones. The rods, which are presented in the outer, are located in the outer portion of the retina and are responsible for the nighttime vision, and also that we're able to see the object, the peripheral object of the things that are in front of us. Instead, the cones, which are located in the centrally vision, and it is responsible for the daytime vision, and also all the objects that are present in the central vision of the things that are in front of us. So as the first symptoms that are most frequent in all the patients of retinitis pigmentosa, they develop what it's called a night blindness. Night blindness because normally the most common and early symptoms is the degeneration of the rods. What I'm saying before, it is the peripheral alter vision. So, and then they will develop the patient what is called tunnel vision, to have a totally legal blindness at the age of 40. So retinitis pigmentosa is considered as an heterogeneous condition because there are more than 90 genes that are involved in such a disease, and has so many different modes of inheritance, such as autosomal dominant, autosomal recessive, and also X-linked. And it's been considered as the most common cases are been occurred as an autosomal recessive because it can occur between 50 to 60% of the cases, and has an early decade, and there are so many genes that are involved to be associated as autosomal recessive for retinitis pigmentosa. And also autosomal dominant, which can occur between 30 to 40% of the cases, has mildest form, and the symptoms has been showed after the age of 50, so it's an elderly age onset. And as a last mode of inheritance, such as Mendelian inheritance, it is X-linked, and in the most of the cases are X-linked recessive, can occur between 5 to 15% of the cases, always as an early age onset, so occur in the early decade of life, and can be associated with myopia as well. And in the rare cases can occur as a non-Mendelian inheritance, such as mitochondrial conditions. And I want to highlight the fact about the importance of genetic counseling and the counselor in specific, because in such retinopathies conditions, the importance to have collect the family history and to be able to recognize the mode of inheritance help us to have a better outcome. Also, I want to add the fact that retinitis pigmentosa can be syndromic or non-syndromic. In most of the cases that has been shown in so many literature, 80% of retinitis pigmentosa is non-syndromic, so it's only confined the eye. And there are so many syndromes that are associated, and the most frequent one are LCA, which is referred to Leber congenital amaurosis, and there are like 10 types of LCA. The most frequent types are LCA type 1, which is a mitochondrial condition. Instead, LCA type 2, which is an autosomal recessive, in specific in the gene that is called RPE65, and it is autosomal recessive mutation. Also, there are syndromes such as macular dystrophy and also cone-rod dystrophy that is presented in retinitis pigmentosa non-syndromic. And also, it's been presented 30% of the cases of retinitis pigmentosa that are considered syndromic RP, And the most frequent one and the most common is Usher syndrome, and it's not confined about the eye disease, but it affects also other organs. So all the patients with Usher syndrome explore or experience deafness as well. And also I would like to add the fact that there are so many clinical approaches been studied, because retinitis pigmentosa at date it's not curable. And for example, vitamin A, which is in specific palmitate, has been given for the patient with retinitis pigmentosa, but it has to be carefully given by a doctor because it's a toxic drug as well. And also stem cell transplantation in specific retinal progenital cells approaches has been done, also surgical approaches. But at date, the most effective approach has been considered the gene therapy approach, and has so many clinical trial phases that start from the preclinical setup that is done on the animal models, in specific about on the Breyer dog, that has shown improvement in the visual acuity, and also restoring the cells. Many clinical trials has showed a high efficacy and a high improvement by the use of the gene therapy. Gene therapy, which is done in two classical methods. The first one, which is intravitreal injection, and it's considered as an easy procedure because it's not considered as a surgical procedure, and it can be repetitive as well, but it's not that efficacious because it cannot cover all the retina. Instead, the second method, which is subretinal injection, has shown a high efficacy. The doctor has to be careful as well because it leads to a damage in the retina, but it's shown a positive outcome. So the subretinal injection that has been studied is on the adeno-associated viral vector and has showed a lot of positive outcome. If you are interested to me to explain all the trials that has been done, starting from the preclinical setup on the animal models to the phase 3 of the trial, I can explain it in a separately video. So if you made it to the end of the video, I hope you enjoyed the video, and I hope I was clear as well. Stay safe and see you in the next video. Bye.